In this video, you'll get a quick overview of the Candida plus IBS profile. I'll explain the Vibrant advantage and the technology used. Then I'll walk through each section of the test, highlighting key features. I'll also suggest complementary tests and end by summarizing the key takeaways and where to go for additional information. The Candida plus IBS profile measures antibody levels to 2 antigens associated with IBS and 11 fungal species, including 8 Candida species, Saccharomyces cerevisiae, Trichosporin ovoides, and Cladosporium. Fungal overgrowth can be the underlying cause of many chronic inflammatory conditions, and fungal overgrowth symptoms can be identical to many other systemic infections, requiring highly accurate lab testing to provide definitive answers. The Candida plus IBS profile also provides insight on past gastroenteritis and foodborne illness impact on the migrating motor complex, or MMC for short. Therefore, this test is helpful for patients you suspect have fungal overgrowth and/or patients with a history of foodborne illness who are now reporting symptoms of altered GI motility, including symptoms of irritable bowel syndrome, IBS, and SIBO, small intestinal bacterial overgrowth. The 2 antigens associated with IBS are cytolethal descending toxin B and vinculin. Briefly, we now know that food poisoning can contribute to IBS and SIBO symptoms by turning off the MMC via molecular mimicry. Anytime you get foodborne illness from E. coli, Salmonella, Shigella, or Campylobacter, those bacteria produce cytolethal descending toxin B, or CDTB for short. To help you kill these pathogens, your body makes antibodies against CDTB. And this is good. You want your immune system to be able to quickly vanquish any bacteria. Unfortunately, CDTB looks a lot like the human protein vinculin. And through molecular mimicry, the body ends up making antibodies against vinculin. Without going into the details, autoimmunity against vinculin indirectly shuts off or reduces your MMC, allowing bacterial overgrowth that drives IBS and SIBO symptoms. If you want to learn more about the exact mechanism, check out the citations on this slide. Vibrant's Candida plus IBS profile is a blood test that can be collected via venipuncture or dried blood spot. Fasting is not required, and there are no dietary or medication restrictions. However, as with all antibody testing, patients taking steroids, immunosuppressive medications, biologic agents, or other immunomodulating medication may have falsely lower or falsely increased total and specific immunoglobulin results. More on this when we get to the complementary tests. Vibrant measures antibody levels using a proprietary microarray plus chemiluminescence. The microarray works similar to ELISA methodology. However, instead of 1 antigen per well, we can measure up to 96 antigens per well. This is possible because we attach antigens to silicone wafers and dice the wafers into tiny microchips, then arrange the microchips, 1 for each antigen, in a 4x4 or 10x10 grid atop 1 pillar on a 96 or 24 pillar plate. 10 by 10 equals 100 minus 4 controls equals 96 antigens tested. The pillar plate is then submerged into the patient blood sample, allowing for the simultaneous analysis of a large number of analytes from a single sample. Finally, a high-resolution imager is used to simultaneously detect chemiluminescent signals from labeled antigen-antibody reactions at each microchip throughout the multiplex microarray. Amplified chemiluminescent signals with high signal-to-noise ratio provide high sensitivity, meaning very few false negatives. This automated process allows for high-throughput, sensitive, and specific analysis of multiple biomarkers from minimal sample volumes. Before we dive into the actual report, I want to remind you that you get to choose how much information to include in the report you download for yourself or the report you share with your patients. You have 3 options: summary, summary with interpretation, and full report. I'll be going over the report that includes all 3 options combined, as it is the most comprehensive. Let's start with a quick overview. The Candida plus IBS profile sample report includes a cover page, introduction, summary, and then lists all 13 markers. The cover page lists the sample type and the results interpretation key. The introduction page includes the methodology and interpretation of report, and I highly recommend reading this page, especially the part of the introduction where it says, "The Vibrant Candida plus IBS test is a semi-quantitative assay that detects IgG, IgA, and IgM antibodies in human serum or dried blood spot for Candida plus IBS antigens with multiplex chemiluminescence immunoassay methodology." And also the part where it says, Reference ranges have been established for adult population using 500 healthy individuals. A classification of green denotes a result that is within the normal reference range. The classification of yellow denotes a result that is moderately elevated with respect to the reference range, and the classification of red denotes a result that is elevated with respect to the normal reference range. The summary shows the high-risk and moderate results along with comment and interpretation. And the full report lists the levels of all 13 markers: 8 Candida species, Saccharomyces cerevisiae, Cladosporum, Trigosporin ovoides, and the 2 antigens for IBS, vinculin and cytolethal distending toxin B. The Candida plus IBS profile includes your patient's current levels of IgM antibodies and the combination of IgG plus IgA for each fungal species. If available, previous levels are also reported. In this example, the patient's levels of IgM antibodies to Candida albicans are in control. However, they have moderate levels of IgG plus IgA antibodies against Candida albicans. If you want to learn more about moderate and high-risk antibody levels to Candida or other fungal species, simply scroll back to the report summary to read the interpretive comment. The Candida plus IBS profile also includes your patient's levels of IgG antibodies to vinculin and cytolethal distending toxin B. IBS SURE results are reported as both a number and plotted graphically so you can visually see how high or low your patient's results are. Again, if you want to learn more about moderate or high-risk antibody levels to vinculin or CDTB, simply scroll back to the report summary to read the interpretive comment. For additional information about each marker, check out the Candida plus IBS Profile Interpretive Guide in your provider portal. Which patients benefit from this test? Well, conditions, signs, and risk associated with fungal infections, gastroenteritis, and post-infectious IBS include gastrointestinal symptoms like gas, bloating, constipation, and diarrhea. Skin symptoms like acne, dandruff, anal itching, and nail fungus. Neurological symptoms like poor memory, anxiety, mood swings, and brain fog. Endocrine symptoms like estrogen dominance, and urogenital symptoms like recurring yeast infections and interstitial cystitis. Before we talk about complementary tests, I want you to think about Dr. Sidney Baker's TAC rules. Rule number 1. If you're sitting on a TAC, it takes a lot of aspirin to make the pain go away. In other words, it's difficult to heal if you don't identify the root cause of your symptoms. Rule number 2. If you're sitting on 2 TACs, removing one does not necessarily result in a 50% improvement in symptoms. In other words, sometimes there's more than one root cause contributing to your symptoms. In addition to the Candida plus IBS profile, consider the gut sumor to investigate presence of fecal Candida, co-infections, or other dysbiotic microbiota, drivers of inflammation, intestinal hyperpermeability, and/or elevated beta-glucuronidase impacting detoxification and elimination. Also, the mycotoxins, heavy metals, and environmental toxins to gain insight into toxin exposure contributing to the total body burden that may be inhibiting robust immune function against fungal species or contributing to gut imbalances. Also, organic acids. Based on known metabolic pathways and enzyme cofactor requirements, these organic acid markers can provide insights into discovering underlying causes of metabolic dysfunction. The comprehensive test includes a yeast and fungal markers panel to assess for the colonization of yeast and the presence of fungal organic acid metabolites, which may be contributing to core clinical imbalances. And finally, total immunoglobulins. Serology testing is based on normal functional immunoglobulin production. The total immunoglobulins test assesses the number of immunoglobulins, which is helpful for those with suspected immune function compromise or those undergoing IV IgG therapy. In summary, the Candida plus IBS profile uses highly specific and sensitive microarray methodology to measure antibody levels to 11 fungal species and 2 IBS markers, assessing the presence of fungal overgrowth and antibody levels associated with IBS and autoimmune-related alterations in intestinal motility. To learn more, visit the link in the video description. If you have questions, please ask them in the comments below this video. Thanks for watching, and I hope you have a vibrant day.